This patient has super, super severe crowding. A lot of general dentists would look at this case and say, I'm sorry, you're not a candidate for Invisalign, and would need the patient to go into traditional brackets. We were able to do this case with Invisalign, cut the amount of time that the patient was in Invisalign trays in half, and set him up to have really healthy gum and bone structure for the long term. So there are a lot of different ways that a tooth can be crooked. A tooth can be crooked because it's overlapping with another tooth. A tooth can be crooked because it's tilted to the side, tilted in, tilted out. All of these crownings need different movements to fix them. When we look at this patient, his teeth are really overlapped. So we need to create space so that way we can spread out the teeth and have them be nice and straight. Expanding or creating that space can be really difficult in certain movements. So doing surgically facilitated orthodontic therapy, or SFOT, really allows us to get a lot more expansion power than we would have with just traditional Invisalign alone. So in order to treat this patient, we did surgically facilitated orthodontic therapy, or SFOT, that allowed his orthodontist to be able to move these teeth and correct that crowding, expand so that those teeth had room to move and become straight and even. And doing the SFOT also allowed us to thicken the gum, thicken the bone, prevent any recessions from happening during those really difficult movements. Those difficult movements can also be really time consuming and not be super predictable in Invisalign trays. The SFOT allows those movements to be much faster and much more predictable. This is kind of a bird's eye view looking at the patient's lower jaw. We can see in the before photo, things are really crowded. A lot of these teeth are super overlapped. And then you can also kind of imagine that these teeth are sort of tilted inwards towards the patient's tongue. In the after 10 months in Invisalign trays with SFOT, we can see that the patient has everything super straight, gorgeous, but also these teeth have been uprighted, and we have a lot more space for the tongue. We have a much more wide U-shaped arch as compared to here, where it's very tight and narrow and almost a V-shaped arch. This is also really good for a number of other things. Giving more room for your tongue helps you to have healthy airway function, less risk for sleep apnea, and just overall helps with mouth breathing and keeping your mouth healthy. So with this severe crowding, a lot of the times these patients aren't Invisalign candidates, or they may be rejected for Invisalign from their general dentist. We were able to do this case with Invisalign, with SFOT, making this patient a candidate for it, and then we were able to get this gorgeous outcome.